In addition to the structures we've discussed so far, there are a couple of other important anatomical features of synovial joints. Remember, we said synovial joints have the most complex anatomy of the three different types of joints. So ligaments are involved inside synovial joints, and they are the structures that are connecting bone to bone in the synovial joint. Ligaments help stabilize a synovial joint. We need the bones involved in the joint to move in certain directions and along certain planes. But you wouldn't want the synovial joint to simply move in any and all direction, because that would not be useful. Ligaments, if you recall, are made out of dense, regular connective tissue proper. Now, when we think about the ligaments inside of a synovial joint, there are two types. There are what we call intrinsic ligaments, and then there are extrinsic ligaments. The extrinsic ligaments that sort of participate in a synovial joint are physically separate from the capsule. So these are what I think most people think of when they think of ligaments. Intrinsic ligaments are actually part of the joint capsule. They are a thickening of the joint capsule that happens to involve a connection between the bones. In addition to ligaments, it's important to remember that synovial joints have a blood supply and they have sensory nerves inside of them. If you've ever injured one of your synovial joints, you know that it hurts quite a bit. Both the capsule of the synovial joint is innervated and the ligaments of the joint are innervated. And those nerves are receiving information about stretch of the joint and pain in the joint. And of course, you need blood supply to a synovial joint, because you not only have to feed the bones that participate in the joint, but that capsule, that joint capsule, is also vascular. Remember, there are cells in the synovial membrane that are critical to the production and the maintenance of synovial fluid, and those cells need a good blood supply. There are a couple of other structures that we need to be familiar with that are associated with synovial joints. So these are not technically part of the joint, but are near the joint and can impact the function of the joint. The first is the tendon. Remember, tendons connect bone with muscle. And just like the ligaments, they are made out of dense, regular connective tissue proper. Tendons are often located near synovial joints, but again, they are not considered part of the joint. Basically, what a tendon is doing is connecting a muscle to that synovial joint area so that the movement of that joint can be carefully guided and carefully controlled. Again, each synovial joint is intended to move in certain directions, but not in all directions. And the muscle in that area is going to help guide that movement. In addition to tendons, we also frequently find what are called bursa around the area of a synovial joint. Now, what a bursa is essentially a little sac, a little fibrous sac that contains synovial fluid. And that means that the inner lining of that sac is synovial membrane. It has the cells in it that will secrete synovial fluid. Most of the synovial joints have bursa associated with them, one or more bursa associated with them. Now here's where it gets a little confusing. The bursa may or may not be technically considered part of the joint. Don't worry about knowing which bursa are considered part of the joint and which aren't. Just understand that some of them are technically considered part of the joint because of where they lie. But other bursa are located near the joint and influence how the joint functions. Now, the job that bursa are doing is helping movement occur where bone and ligament and muscle and tendon and even skin all overlie each other. If you think about the way the tissue surrounds a synovial joint, you've got layers and layers of tissue there, all moving. And what the bursa are doing is helping to facilitate that movement. Now, there are special versions of bursa in a couple of locations that these bursa specifically are quite elongated. They're not little sort of circular sacs or oval sacs, but they're elongated sacs. And they are found particularly in the wrist and the ankle to help facilitate movements of certain tendons. So we call them tendon sheaths. They actually sort of sheath the tendon. They sort of surround the tendon and help it, again, move correctly. The last structure I want you to be familiar with regarding synovial joints is what's called a fat pad. Sometimes around the synovial joint, again, with all the layers of different tissue, with muscle and tendons and ligaments and even skin, sometimes there's some empty space, if you will, some areas between those layers of tissue that is kind of awkward. It's not so much filled with air, but it's a potential space. And what the body will do is lay down some fat in that area to fill up the space. And that normal fat deposition is referred to as a fat pad. On this slide, you're looking at the shoulder joint, both drawn out and also in a radiograph. If you start on the left side up at the top, just to orient you, you're looking at the humerus right here. Here's the scapula. Here's the clavicle. This white area right here represents the joint capsule that surrounds the shoulder joint, or what is more technically called the glenohumeral joint. Now, in addition to the white joint capsule here, you can also see some ligaments that are in the area around the joint. This is a perfectly normal looking shoulder joint or glenohumeral joint from the outside of the capsule again. Now, if you go down here, what they've done is they've removed the joint capsule so we can see a little more detail. Is the actual space with the synovial fluid in it that is involved in the shoulder joint. You can see articular cartilage here on the head of the humerus. You can see a tendon here. Here's that ligament we could see in the other drawing. Here's another muscle that they're showing us is inflamed. There's a tendinitis going on. What I really want you to notice, though, is this right here. That's a bursa. It's just a little sac of synovial fluid. And what this bursa is doing right now is it's just keeping this ligament and this tendon and this bone oriented in a way that's going to facilitate movement. Over here you can see what the shoulder joint looks like in a radiograph. Again, you can't see soft tissue structures on a radiograph. So even though you can see the humerus here and where the joint, the synovial joint is with the scapula, and even though you can see the clavicle here, you can't see the ligament between the clavicle and the scapula. You can't see the bursa. You can't see the joint capsule. You can't see any of that. You don't see those soft tissue structures on a radiograph. You could see those soft tissue structures in some more detail in a different type of image, such as an MRI. On this slide, we're looking at a different synovial joint. We're looking at the elbow here. Up at the top, you're looking at the distal end of the humerus here. You're looking at the radius here and the ulna on the bottom. You can just see a little bit of that intraosseous membrane that connects those two bones. And you can see a bunch of white material here. This is, again, capsule. This is capsule over this synovial joint. You can also see some ligaments indicated here. But the important thing to remember is that the joint, the synovial joint, is the meeting of the bones, the place where these bones meet each other and move in conjunction with each other inside of the capsule. Now, if you come down to the bottom image, the joint capsule and the ligaments have been removed, and you can see that there are bursa in here. So there's a bursa right here between the ulna and the skin. This is one that gets inflamed quite a bit. This is called the Olecranon Bursa. Don't worry about that name, but just know that there's a bursa, 3 bursa actually, associated with the elbow joint. Again, placed in between the layers of tissue in that joint so that they can move most effectively. Remember that all synovial joints in the body are the diarthrosis type. These are mobile joints. They are intended to have a lot of motion associated with them. They help the body move through space, essentially. Some synovial joints, though, are more mobile than others, and you probably already had a sense of that. Certain synovial joints move really extensively in lots of different directions, and other synovial joints are just a little more limited in their flexibility. So we can classify the movement of synovial joints in a couple of different ways. The first way we classify it is whether or not the joint can move in one or more planes. So we can describe the axial movement of a joint as being uni axial, biaxial, or multi-axial. Sometimes you'll read it in certain source materials as triaxial, but in my experience, multi-axial is the more common term. So a uni-axial joint means it can move along one uni axis or one plane. Now, another way to think about that is with the terms flexion and extension. When a joint flexes, the bones come closer together. The angle of the joint gets smaller. When a joint extends, the angle of the joint increases. Now, if the only motion that a synovial joint has is flexion and extension, we refer to that joint as a uni-axial joint. A biaxial joint is different. A biaxial joint can move in 2 planes. It can move in that flexion-extension plane, but it can also move in a plane that we describe as adduction and abduction, and I'll show you what I mean by those terms in just a minute. A multi-axial plane adds one more plane of motion, and that's rotation. So a multi-axial synovial joint can do flexion extension, can do adduction abduction, and can do rotation. Now let's take a look at these terms. When you look at the elbow joint or the knee joint, what you're looking at is uni-axial motion. You're looking at a joint that is intended to flex and extend. When the elbow joint is flexed, the angle of that joint is decreasing. When the elbow joint is extended, the angle of the joint is increasing from here to here. Same thing with the knee. When you flex your knee, you're bringing the knee up closer to the upper leg. You are decreasing the angle of the knee joint. When you extend the knee, you're increasing the angle of that joint. Flexion and extension, that's one plane of movement. And if that's the only plane that the joint normally moves in, then we call it a uni axial joint. Now, when a joint can also do abduction and adduction, this is what we're talking about. So the shoulder joint is capable of abduction and adduction. That's a mouthful. What we're talking about is whether or not a body part, in this case the arm, is moving farther away from the midline axis of the body or is being brought closer to the midline axis of the body. If the body part is moving away from the midline axis, that's called abduction. If the body part is coming in closer to the midline plane, that's called adduction. Now, I'll tell you what I was taught when I was a student to help you remember the difference. When you're taking the arm away or you're taking the body part away, you're abducting it, you're kidnapping it. When you bring the body part closer, you're adding it to the body, ADD. So abduction or kidnapping and adding it to the body. That's a little device to help you remember which is which in terms of this type of joint motion. Remember, the third kind of motion that we see is rotation. And of course, something like your ankle is capable of this type of motion. It's turning the joint in 360 degrees. So we can think about synovial joints in terms of what planes the joint is able to move in, whether it's uniaxial, biaxial, or multiaxial. But there's one other categorization that we do with regards to synovial joints, and it also involves movement. It's not what plane or planes the joint can move in. It's how the joint physically moves. And here are the terms that we use when we describe synovial joints according to this system: hinge, pivot, condylar, saddle, plane or gliding, and ball and socket. Now you'll notice that I've grouped hinge and pivot together, I've grouped condylar and saddle together, and I've grouped plane and ball and socket together. And you're going to see there's a reason for that. So what are we talking about in terms of this motion? A hinge joint has a motion that's very similar to the hinge that allows a door to open. The joint is going to have a convex surface and a concave surface. So part of the joint is going to have a bone that is convex. It's sort of bowed outwards. And the other bone is going to have a concave surface. It's going to be bowed inwards. This hinge type of joint can move along one axis. So you would also consider this a uni axial joint. One of the ways that students are taught to remember what a hinge joint looks like is similar to the legs of a person sitting over a saddle on top of a horse. So the person comes in contact with the saddle the same way the bones come in contact in a hinge joint. The saddle has a convex surface. It bows upwards, if you will, and the legs of the person have a concave surface when they come together. Now, a pivot joint is similar, but it's different. A pivot joint is that kind of joint that's like a peg inside a socket. Okay? It's spinning in terms of its movement. It's as though you put a peg into a into a socket. You could rotate that peg in there. That's the kind of movement that it could have. That peg could spin inside that socket. That's a pivot type of joint. Condylar joints, similar to hinge joints, have a convex surface on one bone and a concave surface on the other, but unlike hinge joints, condylar joints can move in two axes. So a nice visual representation of a condylar joint is like a mortar and pestle. Think about a mortar and pestle that has, a bowl and then that instrument that you can insert into the bowl to crush things. That mortar and pestle system can move in more than one direction. It can move along two axes. A saddle joint also has that convex-concave combination within it, and it also moves along two axes. Could also call a saddle joint a biaxial joint. Now it's helpful to visualize, again, a person sitting on a saddle, to visualize a saddle joint. But unlike a hinge joint, the saddle joint can move in two planes. So you can envision the person sitting on a saddle, and not only can the legs slide from side to side over the saddle, but the saddle can slide forward and backwards. Plane joints or gliding joints involve two surfaces that are flat, and those two surfaces are simply going to pass each other back and forth. They're going to glide past each other. Ball and socket joints, which you may already be familiar with, you can also sort of envision like a mortar and pestle, but unlike the condylar joint, a ball and socket joint has much more motion associated with it. A condylar joint is limited by the edges of both surfaces of the bone. Think of it like that the mortar cannot rise out past the edges of the pestle. In a ball and socket joint, you've got a spherical piece of bone inside a concave socket, and that ball can rotate in multiple directions. So plane or gliding joints and ball and socket joints could also be considered multi-axial joints. On this slide, you're looking at a table with pictures representing all 6 of those categories of movement for synovial joints. So the hinge joints and the pivot joints and the condylar joints and the saddle joints, the plane or gliding joints, and the ball and socket joints. I know it's hard to see the details of this table, but when you open up the slide set, when you have a moment, you can enlarge this for yourself. You can even print it out if you find that helpful. This, I think, is a useful table because it not only gives you examples of where we find each joint type, but it shows you in a model how the movement happens. So, the gliding or the plane joint can move in a multi-axial manner. It's just two flat bones sort of sliding past each other. So you can see this multi-axial movement going on. In comparison, a hinge joint is only going to be able to do the flexion and extension type of motion, and so on with the other types. On this slide, there's just another image that essentially does the same thing for you. It shows the 6 movement types of synovial joints. It shows an example of where that joint would be located in the body. And it gives you a model here in pink showing how that particular joint moves and in how many planes. Now, to finish up today, I just want to mention that in addition to the planes of movement that we discussed, and remember those are flexion, extension, adduction and abduction, and rotation. We used those terms to describe the 3 planes in which synovial joints can move. In addition to those, there are lots of other terms that get used in describing the movement of joints. And if you read about joints in textbooks, you'll run into these kinds of terms. We're not going to cover these in lecture. So I just want you to know that there are a lot of other terms that get used to describe joint motion. But for our purposes, the 3 planes and the 6 types of mobility are what are important for our understanding of the function of joints.